welcome to this overcast yet beautiful day in downtown Cleveland for the Cuyahoga County Public Safety and Justice Affairs Committee meeting. Roll call, please.
Calling the roll, Mr. Gallagher.
Here.
Mr. Greenspan. Here. Mr. Germana.
Here.
Mr. Harrison.
Here.
Ms. Conwell. Ms. Conwell is absent. There is a quorum.
Ms. Conwell's on her way, she called, so we'll leave that open there. Is there public comment?
No, Mr. Chair, no one is signed in.
In the packet, we have the minutes of the July 21st meeting. If they're in order, I'll accept the motion. Approval?
Second.
All in favor? Against? Thank you. Resolution 2015-0152.
Resolution number 2015-0152, amending resolution number 2014-0102, dated 4/8/2014, which authorized the county executive to accept, on behalf of the county, the donation of burial plots within Crown Hill Cemetery, Twinsburg, Ohio, from William Sohay Jr. for the purpose of accommodating indigent burials by changing the number of plots from 4 to 8 and the approximate value from $4,000 to $8,000.
Thank you. Is there anyone here to speak on this? We've done this numerous times, and these are really welcome additions to the county for our indigents. Sir.
Chairman, Steve Shannon from the Medical Examiner's Office. Is it on? Okay. It actually amends last year's proposal. It was just lost in the paperwork that there were actually twice as many plots. So I think the next one is the new item that actually there's a second donation from this gentleman's cousin who, I guess word of mouth spread, they had some extra plots as well. We've been steadily collecting burial plots around the county. We're hoping to accumulate enough of them that we can actually get some negotiating power with the cemeteries themselves to be able to make a program viable. Right now, it's still more expensive to both open and close a plot than it is for us to work with the city of Cleveland, who has their own city-supported cemeteries, to be able to do indigent burials there. What we're hoping, though, is to be able to negotiate with a couple of these private cemeteries where we're accumulating now numbers of plots to be able to make it more affordable for indigent burials.
Thank you. Any questions? Okay. Is there any need to move this forward on an emergency basis? Or?
No, sir.
Okay. We'll keep this in committee and read it at the next committee meeting and move it out.
And Dr. Gilson sends his apologies. He's chairing the child fatality meeting, or he would have
that's
come.
fine.
So.
That's fine. No question. Janine, did you?
I was going to ask a question. So you want to hold this item, Mr. Chair? You don't want to move it out for second reading?
You know what? We can move it out and read it second reading in committee or the full council. So I'll accept the motion to move Resolution 2015-0152 to the full council for second reading.
Move for second reading.
All in favor?
Aye.
Against? Thank you. And Resolution 2015-0153.
Resolution number 2015-0153, authorizing the county executive to accept, on behalf of the county, the donation of 2 burial plots within Whitehaven Memorial Park, Village of Mayfield, Ohio, from Society of St. Vincent de Paul, valued at approximately $2,000 for the purpose of accommodating indigent burials.
And same, these are
Again, yes, sir, Mr. Chairman. It's we're continuing to accumulate those plots, and it seems to have centralized around 2 cemeteries right now, anyway, in Cuyahoga County. So our manager of morgue operations will be going out to negotiate and see if we can't cut ourselves a better deal.
Okay. Mr. Jamila.
I just have a question. I'm just wondering why something like this is coming to full council action instead of one of our
Unfortunately, it's technically a real estate transaction, so county charter requires all real estate transactions to come before council.
Good answer.
It's little real estate, but
This may sound odd, but do we in any way recognize the donation, a letter from the executive or the council, or?
that's a good question. I know I've thanked them all profusely myself, but that's a,
Or minimally from Dr. Gilson, but I think it probably should come from the executive, so maybe we could make that a suggestion to the executive to, because these not only are valuable, they're needed, and we appreciate it.
I will bring that up.
Okay. I'll accept the motion on resolution 2015-0153 for second reading.
Second.
All in favor? Against? Thank you.
Thank you.
Resolution 2015-0161.
Resolution number 2015-0161, authorizing an agreement with the Metro Health System in the amount not to exceed $607,747.96 for healthcare and management services for youth residing at the County Detention Center for the period 7/1/2015 through 12/31/2015.
Hello.
Good afternoon.
Good afternoon. You made it.
Yes, I did. Little parking,
We were going to hold everything for you,
as you should.
as we should.
Yes, good afternoon. So this item from juvenile court, Karen Littman from juvenile court. This item is our agreement with Metro Health System. So 2 years ago, we went into a master service agreement with Metro Health with a number of other county entities. And juvenile court section ended June 30th of 15. The other entities have different end dates that sort of extended out. So knowing that ours was the first to end, I tried very hard to sort of rally the troops starting last October to get an amendment to extend this, and it just wasn't happening. And I knew that we needed this service on July 1st. So we sort of then just entered into our negotiations with Metro and just extended it for 6 more months, or actually it's a new agreement because we couldn't extend the master without everyone's agreement, for the services in the detention center, with the hope that if that master service agreement, we sort of gave more time for that to happen. But in the meantime, these services are for doctor and nursing services, as well as what we call clinic services, which is when youth need some kind of hospitalization or need to go for testing. And this is for all youth that are in the detention center. So it's 24/7 nursing care, and then we have either a doctor or a physician assistant who's there 20 hours a week. And then also the labs and x-rays and other kind of testing for those detention center youth.
Right. What do you guys do on the drugs?
The pharmacies is a separate agreement. We actually had a conversation 2 years ago with Metro regarding the pharmacy services, and they don't have the right license to provide the services for us. They're the ones who said, no, you better go someplace else. We need medications delivered on a daily basis, or minimally, I think, 5 days a week, but almost daily. And they also don't have the right, if I remember right, there's also something about disposal of old medications that they aren't able to do that. So there was a number of things that Metro didn't have that they couldn't provide for us.
You don't have a pharmacy on site? So your drugs
There's
come
a
daily?
there's a place where they keep the medications on site, but we need medications that are delivered on a daily basis because we've got youth coming and going so frequently. As well, we prefer to use as many medications as we can in what they call the blister packs. So you can get like 6 or whatever, or 12, as opposed to getting a whole prescription for 24 for a youth that may only be there for a few days. So we're able to, and those that are in the blister packs are able to keep and reuse because they're all individually sealed, as opposed to if it comes in a bottle, you can't reuse it again. So there was a number of reasons, and Metro were the ones who told us that they just weren't able to sort of meet a lot of that criteria.
Well, they told us a lot of that too, and we got around it. So maybe that's one of our missions for the coming year is to somehow get around those barriers.
So the court is getting ready to release an RFP for our pharmacy services, and we certainly will be sure that, I don't think it has been released yet. We're probably in the next 2 weeks, 3 weeks. It'll be released. So we'll be sure that Metro gets a copy of that and see if they can respond. We've tried, I think the last 2 times we asked them to look at it and respond, and they just weren't interested.
Maybe within 2 weeks, maybe we should have a meeting and hear their side of it, because it's always 2 sides. But we had heard no for so many years, everybody just accepted no until we finally, got an ear over there and clean up the board a little bit. So let's see if we can't at least get some notice, and maybe there is a good reason that they can't, and which would be fine, but if they can, they should.
It's been 2 years. There may be a license, there's a certain kind of pharmacy license that they need that they're not able to, I seem to remember that was something, and now that could have changed in 2 years, or I could be remembering incorrectly as well, but that may also be part of the problem.
Janine, if we could set up maybe a meeting with the folks at Metro and Juvenile for next week or the week after, whatever's convenient for all parties.
Absolutely.
Okay? Any questions on 0161? Mr. Greenspan?
Great, thank you. Just a couple questions. So obviously this amount, the 607, is that within the budget? for
Yes,
the
this
year?
is within the budget. This is the exact same amount that we paid the last.
6 months.
Well, yeah, I mean, it was a 2-year agreement, so it's 6 months' worth, the exact same amount. So the doctors and nursing portion is a set amount each month for those services. And then we put in the extra money for what we call clinic services, because we don't know what kinds of labs or x-rays or testing or whatever is going to be needed for youth, or hospital admissions or whatever. So we put in a set amount based on past experience to cover that. So, but it's the same amount and it's within the budget.
Has Metro been able to, so within this contract, there are a fixed number of physicians or physician's assistants and nurses. Have they been able to sufficiently staff up to the previous contract?
Yes, so the way it works is that the physician assistants is 20 hours a week. So that fluctuates a little bit as needed. The nursing is 24/7, so there's one nursing supervisor, and then there has to be one RN each shift, so you've got 3 shifts, 7 days a week. And then we sort of backfill that with LPNs because it sort of cuts the cost a little bit, but you need to have one RN at least on each shift.
But that's included in the contract.
But that's included in the contract. Yeah, there's a schedule in the contract that actually says how much staff we need each shift, each day.
The reason I ask, because there's a challenge in the adult detention center with Metro being able to staff it sufficiently, so much so that Metro, what we're hearing is deficient in providing the staffing for the current contract, so the county is having to actually hire independent third-party medical staff. And so what's happened is the contract is fixed with Metro, they're not performing pursuant to the contract, we're paying the fixed amount, and now we're basically duplicating services that should have been provided here with independent contractors, and our costs are $1.8 million over budget. So, or $1 million over budget. So I just want to make sure that that is not the case here.
No, we do not hire any independent medical staff whatsoever. And I don't know, maybe if it's different for the kids, the pediatricians and the pediatric nursing staff. The nurse supervisor is, it's the same person working all the time. And I'm pretty sure most of the nursing staff are the same folks that come in, and this is just where their rotation is. So it's not rotating. I'm not sure if an adult, whether they're rotating people or they can't keep people at that particular site for whatever reason. But I think that the folks that are at the detention center are pretty much the same folks all the time.
Okay. And based on our procurement process, the contracting approval process, you're going to have, in order to meet this deadline, have this into the county probably by November to go through the new contract.
Yeah, we're already working.
Okay.
We've barely had this one's,
Right.
initially signed before we sort of started the process.
So that's where I was going. So you are
Yes.
starting the process.
Absolutely.
Okay. I have no other questions.
I'm just wondering if if there's any, I don't know what the law is about if any of these juveniles are covered for hospitalization through their parents or guardian, do we go after reimbursement?
I do know that while most of the youth that go through the court system are Medicaid eligible, Medicaid is not eligible when you're in a locked facility, so we can't use any Medicaid funds. I don't think that you can go after third-party insurance. I do know that for any youth with any kind of chronic or really sort of long-term medical needs, we really work to get them back in the community so that the court doesn't incur long-term costs. I know, even if a youth has to have a hospitalization or a surgery or something, we actually release them so that they can either be covered by third-party insurance or covered through Medicaid, and then consider readmitting them when they're healthy enough to come back in. So I'm not sure if third-party, I think it would be really difficult for those that do have some kind of third-party insurance to recoup those costs. I know that Metro does follow up with a lot of youth that have conditions or are referred out, and we have to be really careful with those invoices that come in and look and see the date of service and say, this kid wasn't even in the detention center, and send those invoices back. So that's sort of a continual process. So, but I can certainly look into, I know Medicaid is off the table, but I can look into the third-party insurance question.
This raises the bigger question, not, we're talking about juvenile court, but in the bigger scheme of things, under the county jail, I'm just wondering if there's any program to see if we could recover. I know what's happening. I'm familiar with University Hospital, Parma Medical Center. Any senior or anybody that's on Medicare, the hospital's got to accept their Medicare, and that's a big discount to the hospital. So if it's any parking lot or theater or business, they automatically question whether that business or parking lot has got medical payments. And they're going after it so that they can get full reimbursement or full pay. And it's huge. It makes a huge difference if you're getting what you're allowed in charges versus what you have to accept from Medicare or Medicaid. I don't know if this is opening up a can of worms, but it might amount to, I don't know how much. I'm just wondering how much we're paying. If we're paying $607,000 for 6 months in juvenile court, I just wonder how much a bigger question of that is for the county jail.
I would suggest probably not a big recovery there. Majority of the people in jail are indigent to begin with. Juveniles, I don't know how hard, that would be more of a web than the regular detention center. Is like I said, most of them are indigent and so proclaimed by the courts. And those with money, I don't know if it'd be worth hiring the person to follow the trail. I don't know if the bang would be come back for your buck.
Well,
We could see, but I highly doubt, given the clientele, that there's going to be much recovery there at all. And there may be something in the law, I don't know, Counselor. Once you're in detention, isn't that a ticket on us?
I don't know. I'd have to, we'd have to do some research on that question. I
Yeah.
think it's a very interesting question.
It is.
That Councilman Germano poses. So I take it that our jail administrative staff has probably asked that question themselves, but we can direct it to their attention, and we can do some research in the law department ourselves.
I may be wrong, but I seem to recall this having been discussed before. And something in the back of my mind tells me that we can't go after those, but why don't we find out? Okay.
Right. Yeah, I was just, this kind of intrigued me of thinking of the bigger picture. Because I know we had a Councilman, Paul Kerner in Parma, that was trying to go after room and board for people that were in the Parma jail. Because, hey, it's a free ride, medical care, all your meals. So maybe we should save this for the bigger question, but if you're gonna check into that, that'd be great. Thank you, Mr. Chairman.
I can tell you the vast majority of the costs here are just the monthly fees for nursing and doctors. So probably in this 607,000, there's maybe $100,000 that's set aside for the stuff that the lab testing, the X-rays, any kind of potential hospitalization for the youth who's injured while in the detention center. But the vast majority of this is just the 24/7 nursing staff and then the 20 hours a week with the physicians.
Okay. Nothing further, because it's already started. We're behind the 8 ball. I'll accept a motion on Resolution 2015-0161 for second reading adoption at the next council meeting.
Second,
All in favor?
aye.
Against? Thank you very much. We'll
Thank you.
get that answer back to you if you're also intrigued, and we'll set up a meeting with Metro within the next 2 weeks. Okay? Thank you very much. Miscellaneous business? Other comment, other public comment?
No, Mr. Chair, no one has signed in.
Thank you. We're adjourned.